family has a network of support. There are some people in our society who are lacking the network that the average family has. They don't have the extended family, and sometimes they can't afford regular services. So we're here for that family, and we try to provide that support that, you know, the average family would already have. So we're the other piece. We're the people they can come to and say, hey, let's juggle this schedule. We're here from 8 to 4. See what you can do. We've got your kids.
Some may, not have a babysitter for that day and have to go to work, or mom may just be a little stressed, and dad also, a little stressed and just maybe need a break, which is important, for that parent to get that break. Others, doctor's appointments.
And some of them are working and haven't got a voucher yet. And some of them, they're homeless and they don't know want their, other half to know where the children are. We have had cases where the mother, was abused, and she, would come here and bring the children, and she didn't want the father to know that they were here and where she was.
We're a prevention piece where intervention is after the fact, and they're trying to change a situation. We're preventing a situation from occurring. And I'm excited in the essence that we have been establishing, identifying stressful situations, and that's where it's coming all down, is that if you're able to help a family in a crisis, in a stressful situation, remove the child, have them come, play at ARC, mom and dad can take care of business or even simply have respite to be a way that we have prevented or have encouraged the parent to relieve themselves, to remove themselves from a stressful situation and come back and feel that they're able to care for their child in the most appropriate fashion.
We are very unique. We don't only serve just the children, we serve the whole family. We noticed that a lot of our families were needing assistance in other areas other than child care. When a family comes in or calls in, and they ask about our services, usually we ask them what they need. We have intake specialists that pretty much assess, the situation, what is the need, basically how can we help you. And then we also have a volunteer social worker, a licensed social worker, so she's very knowledgeable of all the other community services out there. And it was also like another extra hand, we want to do everything, but we couldn't necessarily do everything. So what maybe we couldn't do and or say, she could step in and then do what was needed and help point that family in that right direction of whatever that need is.
We have 35 very strong collaborating partners. When I say strong, it's when we pick up the phone and we're in need of their services, they'll call us back or they'll put us at the front of the line. We're not alarmists here, but we're able to identify that mom or dad need the help right away. Some of them that we work closely with is Southwestern Mental Health, Ozanam, the Domestic Violence Shelters, YWCA, Albion Fellows Bacon Center, Stepping Stones with the Drug Support Rehab Group. We work very closely with Department of Children's Services, with CASA. It's a collection of agencies that are able to offer that professional resource for parents. We provide the care for the children, and they're able to add the additional help to mom and dad. We have an ARC family, and that's our team, that's the staff. And each one plays a pivotal role in changing the life of a child here. The parents will come in, and many a times they appear like they're very confident, or that they don't have very many issues going on, or that they're doing okay when they hit the door. But when they drop off their child to the teacher, then communication, the comfort level increases, and then teachers are able to really get into the life and realize, or to find out, discover what actually is going on, because the parents are comfortable in wanting to share with them. They have a listening ear.
I had one parent that came in, a new little boy. He was about, I'll say 9 months, and the parent, she was really nervous about leaving him, because she had bad experiences with daycares, and I just went out and, introduced myself and let her know what goes on in the room, and she felt comfortable with that, and he came for about 2 days, and she was really happy.
I consoled the lady yesterday. She had a problem with sitters, said she was abused as a child, and so they came and got me and wanted me to console her, so I did the best that I could. So she said she's gonna bring the baby back next week too.
There's several times when I'll walk in the door where my staff is giving a parent a hug. That's what that parent needed in order to face what's out there in the real world and the business that they have to take care of. Just imagine your household and what it takes to run the household with little ones. And if you have 21 little ones running around, we go through 40 gallons of milk a month. We have the diapers, we have the diaper wipes, and the snacks, the juice, just basic toys, supplies, for the classrooms. But oh my goodness, from sunscreen to sandbox toys to putty, to socks, to shoes, because many of our children, they'll come in and they're not equipped with their proper clothing. In the winter, they might be showing up and they might have a spring jacket on. So it's a continual, supporting a family, but also running a household. We've got our electric, we're doing the washing and drying. We don't outsource any of our services at this point. So all of us are running around, and it is managing a household. If our crisis wasn't in the community, for example, last month we had 373 children walk through our doors. And if ARC wasn't here, where would those children be?
And I think about that child that was abused and died and wish that family had known about us.
We can change lives with your help, with corporate individual help. They are the ones that actually are changing the life because they're enabling us to do so. We could never do it without the support of others. Never. That's critical.